Greetings to all. I'm Dr. Lavanya. I'm going to present a paper on comparison of voids between two different obturating materials examined under stereomicroscope and in vitro study. The primary objective of root canal obturation is to provide a complete fluid-tight seal to prevent reinfection of the root canal via leakage of microorganisms and their byproducts. The sealing ability of a root canal filling material is therefore an important factor in achieving this goal. Guttaflow in combination with the root canal seal is the most commonly used root canal filling material, and its ability to seal the root canal dentin laterally remains questionable. To overcome this drawback and to improve the quality of obturation, several obturating materials have been introduced in the market with the capacity to expand slightly. Guttaflow is a new self-curing filling material which contains guttapercha in particles less than 30 micrometer. Sealer, which is used as polydimethylsiloxane, which has been used in dentistry and prosthodontics, and it has limited dimensional changes in setting. The advantages of Guttaflow is that it does not need any heat to soften the material, so it doesn't have any shrinkage. Sealer and guttapercha is available as a single material, and it can be dispensed easily. It is thixotrophic material, and the viscosity reduces under pressure. Along with the smaller particle size, it can flow into the accessory canals as well as the lateral canals and does not require any condensation. It can adhere to the guttapercha and dentin. It has a very low solubility of 0.00%, and it has microsilver that provides optimum protection against reinfection of the canal, and the concentration in silver is very less. It doesn't lead to any corrosion or discoloration. Guttaflow is available as a capsule which can be titurated in a titurator for 30 seconds and can be dispensed using a dispenser gun. Or it is available in syringe form which can be dispensed on a mixing pad and introduced into the canal with the help of a Lentinos. Several studies have shown that Guttaflow has good adaptation to the root canal walls, and after setting it has a setting expansion of about 0.2%, which is an excellent seal to the root canal. Another material which is C-Points, a bioceramic sealer which is a smart paste bio. The C-Points contains a center core of nylon polymer which provides flexibility so that it can be used in a very curved canal, and it has an outer hydrophilic hydrogen layer which can swell laterally. Several studies have shown that the expansion of this C-point is the use of the dentinal fluid which is present in the dentinal tubules in the nylon fibers, and this expansion is a lateral expansion rather than an axial expansion. The bioceramic sealer which provides an antibacterial effect, and it has a setting time of 10 hours, and it releases calcium hydroxide and hydroxyapatite crystals which helps in the formation of new bone matrix. So by using these two materials, the purpose of this study is to determine the area occupied by voids in the different thirds of the root canals obturated with C-point with smart paste bio and Protaper GP with Guttaflow using a stereomicroscope. So the materials used are Protaper GP and Guttaflow, and C-points and bioceramic seal. So the methodology consists of freshly extracted 20 single-rooted premolars were taken. The cervical thirds of all the root canals were prepared with GG drills 1, 2 and 3. Working length were determined 1 mm short, and it was confirmed with radiographs. Root canals were shaped and cleaned with 9-type Protaper instruments, and they were divided into two groups, in which one group the canals were filled with C-points and smart paste biosealer, and the other group it was filled with Guttaflow and Protaper GP. Roots were sectioned transversely into 3 equal thirds using diamond discs, and the section A were examined under stereomicroscope, and the area of the voids analyzed by student t-test. The process went on like this. The single-rooted premolar were taken, the radiographs were seen for patency, and then the cleaning and shaping were done with rotary Protaper and the obturation with bioceramic sealer and with C-points, and they were sectioned into coronal, middle and apical thirds and viewed under stereomicroscope 20x magnification. This were grouped as group 1. The same process were done for the other Protaper GP with Guttaflow, and it was termed as group. These are the section tooth. This is the results. Results shows that the voids in the coronal, middle and apical were more for group 2 rather than group 1. So the mean volume percentage of voids of various cross sections also revealed that there were more voids in group 2 rather than in group. Percentage of voids in the sealer, it revealed that there were more percentage of voids in group 2, which was about 2.39% rather than group 1, which was just about 0.02%. In the study, single-rooted premolar teeth with single patent root canal were selected to minimize anatomical variation. All the teeth were decoronated to easy accessibility to root canals. The root canals were prepared with Protaper universal rotary instruments, and match taper master Protaper gutter pressure points were used to fill in the canals to provide similar sealing ability. Stereomicroscope were chosen for this study as this provides a three-dimensional view of the surface to be examined. Occasionally, there are voids in the obturated root canal, and if it's so present, voids within the filling material known as internal voids and are considered less clinically relevant because bacteria, if present, are confined in an unfavorable environment. Voids along the root canal walls are known as external voids, and voids in the filling material communicating with canal walls when combined void may jeopardize the outcome because they are in contact with potentially infected root canal walls. Present such voids may prevent failure of the sealer and lead to leakage. In this study, all the types of voids were evaluated together. This picture shows voids in the coronal section and the voids in the group 2. We can see the external voids, and there were absence of voids in group 1. This is the voids in the middle section. You can see there is a combined voids in group 2 rather than in. This is voids in the apical section where you can see voids in the external area, and that is in group 2 rather than in. So all the gutter flow is known to expand slightly while setting is showed presence of voids. That might be explained by the filling technique used. The use of the single cone filling technique may result in a higher volume of sealer relative to the volume of the cone, which may promote void formation and reduce the quality of the seal. C points with single cone filling technique showed no voids in the middle third and an apical third due to its lateral expansion, which is attributed to water-induced swelling of its vinyl pyrrolidine acrylonitrile outer coating by non-Fickian type of water diffusion into vinyl pyrrolidine acrylonitrile cross-linked copolymer. In conclusion, the results of this study show that the C points with smart-based bio demonstrated suitable for obturation, suggesting that the current gold standard needs to be reconsidered by dental practitioners. In future, further studies are needed to evaluate the impact of the present finding on a long-term outcome of root canal therapy. Thank you.